Well, in 2021, our senior health correspondent, Monica Robbins, had her second brain surgery. This was done through her eyelid, and she became just the seventh patient at Cleveland Clinic to have this type of procedure.
So September is Brain Aneurysm Awareness Month, and Monica explains how what helped her is now helping others.
In 2021, I learned my brain tumor spread toward my cavernous sinus and would have to be removed. A year earlier, Cleveland Clinic began doing transorbital neuroendoscopic surgery, or the TONES procedure. They cut along the crease of my eyelid and were able to remove as much of the tumor as possible, buying me more time. Barbara O'Hara's neck pain and migraines stopped her in her tracks.
Oh, that pain was just awful. Just excruciating.
She was referred to Cleveland Clinic, where she learned she had a brain aneurysm.
We can think about the brain aneurysm as a bubble in the artery of our brain. The problem with aneurysm is that that bubble can eventually rupture, okay? And if it ruptures, it can cause a stroke.
That meant brain surgery, but instead of the traditional invasive type that would require a large incision along her hairline, Barbara qualified for the minimally invasive TONES approach through her eyelid.
Most of the aneurysms that we found in the brain are really close to that area, okay? So with a tiny incision over the eye and do the same clipping that is done with the open surgery, but in a much less invasive way.
3D imaging is used to help plan the surgery to ensure safety. Most people go home the following day, and while it takes time to recover from the eyelid swelling, I can personally tell you it was easier than having a craniotomy.
And you never know I had surgery. There's no scar. To wake up and have no pain. I was amazed. I can get out in the sun and enjoy my life.
Now, the TONES procedure can be used to treat a variety of conditions, from brain tumors in the sinus and pituitary areas, abscesses and orbital and eye issues, and it can also help repair cerebral sinus fluid leaks, and it's also being used in some epilepsy cases as well. It is certainly not for everyone, and not all patients qualify for this treatment, but it is good to know that there is an option, and it's also good to know that we live here in Northeast Ohio and we have access to it, because there aren't many centers around the country that actually do this procedure.
Oh, wow.
Yeah, so two things. One, were there any side effects for you? And two, I think everybody would like to know, how are you now? What is your status?
So first thing for me, remember the tumor is behind my left eye and it's pushing my eye out of my head. So for me, the side effect was I had some difficulty closing my eyelid. So I had some significant dryness, and that was a big side effect for me. So I had really, really tough eye pain. Doesn't mean everybody would have that.
And did that last for a while?
It lasted a long time, yeah, and I'm still dealing with it, actually. But and as for me, it's never going to be over for me. You know, my next scan is next month, and we'll find out where I go from there. But you know, I keep crossing my fingers that, you know, I live here. I never thought I would qualify for that particular procedure, but I did. So who knows if this thing keeps getting nasty and keeps growing, you know, there might be something else.
You know, we pray for you very often, just so you know.
Thank you. Thank you.
Yes. Thanks for sharing your story.
Appreciate it. Thanks guys.
Mom.